I'm Marla Shue. I'm one of the founders of Gateway to Hope. Dr. Kaplan and I started that about 10 years ago.
When we started the program, our hope was that in 10 years we wouldn't need to have a program like Gateway to Hope, but unfortunately that hasn't proven to be the case.
In the early days of Gateway to Hope, it was an organization really that was basically a clinic without walls, where the concept was to provide donated care to individuals with breast cancer.
Whether it be surgery, whether it be chemotherapy or radiation, reconstruction, whatever they needed.
I needed to have a ultrasound or some kind of a test. I think it was some kind of test they were trying to, and the lady calls me back and she says, what did you say your insurance number was again? And I'm like, and I gave it to her again. She said, well, this says that this insurance has been terminated. Now I've had a double mastectomy, and now they're trying to figure out what treatment they're going to do, and I don't have any insurance. So I go home and I'm telling my one girlfriend, I'm like, hey, I don't have any insurance. She said, there's a program called Gateway to Hope.
Anytime we're able to help a patient, then to me that is a success. Whether it's a very small assistance with maybe one utility bill, or whether it's really helping them pay that insurance premium so that they can get comprehensive breast cancer treatment that they may need.
Along with that, we continue to do things through Thelma's Gift. We're able to help with any ancillary costs. It could be rent, mortgage, it could be daycare, gas cards, all of those things.
It would be impossible to have programs like Thelma's Gift if it weren't for the generosity of people like Ronnie Chad. We lost Ronnie this year, and it was a huge loss to all of us who were friends of his.
The other program, which is Gail's Legacy, which has been in existence for several years and primarily was involved with COBRA, is now where we also house the insurance premium program.
The original Gateway to Hope model, the donated services model, still is relevant. We still provide care through physicians and facilities who provide services at no charge to the patient. But the IPP program, the insurance premium program, is really revolutionary.
What we found is if someone doesn't have insurance, obviously they don't have access to care, but if we can help them keep insurance or get insurance, then they can continue their care pretty much anywhere.
So it's hard to believe that Gateway to Hope is about to celebrate their 10th anniversary. I look back into the early days, and I remember we helped 12 patients the first year, thinking that that was really going to be good if we could do one patient a month.
I'm very proud of the clinical team we put together. The Gateway to Hope organization is just remarkable. We've treated between 700 and 800 women over the last 10 years.
But then again, referring out more than 1,000 has really tells you where we've gone from that original inception of let's see if we can work with one patient a month.
I see Gateway to Hope evolving as the needs evolve.
There may be a day when Gateway to Hope expands and maybe even can go into other communities, maybe around Missouri or maybe even in other states.
All we provided was a vision, and if it weren't for all of the people who have donated so much in terms of resources and time, the organization never would have flourished, and we wouldn't be in the position where we find ourselves today.
It's a team. It takes a true team to make Gateway to Hope successful.
It's a chain, and we don't have any weak links.
I'm just so happy that they came up with this idea. I love this organization. Gateway to Hope is wonderful.